Hey, it's Chris with ROE Dental Laboratory, and I want to talk today to the dental community about miniComfort, which is our lower bite guard, very comfortable, very flexible guard. We get a lot of questions about this, so I want to kind of cover one of them today, which is how long should a miniComfort last? Now, the miniComfort, it's not like your typical hard bite guard that's uncomfortable. It's a very comfortable guard that goes on your lower only, so it's a mandibular guard, and it's a very flexible, very comfortable guard. Now, when you order a miniComfort from us, we send two of them, and there are actually two different thicknesses you can choose. There is a 4.0 and a 6.0, which is really a 1 millimeter and a 1.5 millimeter thickness. Could be daytime, nighttime type situation, just depends on the patient and how much they're grinding, bruxing, all that fun stuff if they're a clencher during the day. So you kind of leave that up to yourself as far as what thickness for the patient based on their wear patterns. But as far as how long they last, if you have a patient that's really a big grinder, especially during the day, and they don't even realize it, the thinner one during the day, the 4.0 or the 1 millimeter thickness, there's a chance they could kind of grind through pretty quickly, because as you can see, again, it's a very flexible, comfortable guard, 1 millimeter thick. Not a super thick guard, so there's a chance that they could grind through it fairly quickly within a couple weeks. That's the reason why we send two of them. So this is kind of a built-in insurance policy, and that's a conversation you want to have with the patient. Set the expectation up front that we're going to kind of go through this and see how this works before we even go down the road of a hard bite guard that's really uncomfortable. So set the expectation. There's a chance they may grind through it, but don't worry. We have two of them for you. For your money. So that's kind of a built-in insurance policy. So as far as how long do they last, I can use myself as an example. I wear a miniComfort. I wear the thicker one, so the 1.5 millimeter every night when I go to bed. Whether I'm traveling home, it doesn't matter where I'm at, I am putting that miniComfort in, the 1.5 millimeter, and I'm a clencher. So I clench a little bit of bruxing at night, not a ton. But I'm biting down onto the discluding elements on the miniComfort when I sleep, and I get 10, 12 months out of one. So again, it varies from patient to patient, but a light grinder, light bruxer at night, you're gonna get some good time out of it. And again, we send two of them, so there's a chance that could last if they're like me. Again, somewhere on my cuspids. So again, not a huge grinder, but if you're like me, you can get a couple years out of these two miniComforts. So if you have any questions on the miniComfort, leave them in the comments section and we'll get back to you. And again, we'd love to get a miniComfort for you and one of your patients. Thank you.